Why do recovery tips emphasize avoiding strenuous activity after surgery? Have you ever wondered why recovery tips often stress the importance of avoiding strenuous activity after surgery? This guidance is crucial for ensuring a smooth and effective healing process. After any surgical procedure, including plastic surgery, your body requires time and energy to recover properly. Engaging in strenuous activities can interfere with this vital healing process in several significant ways. When you undergo surgery, your body initiates a complex healing response. This includes repairing incisions, reducing swelling, and rebuilding tissues. Strenuous activity, such as heavy lifting or vigorous exercise, can disrupt these processes. For instance, physical exertion raises blood pressure and heart rate, which can lead to increased bleeding at the surgical site. This not only slows down healing but also increases the risk of complications like hematoma, which is a collection of blood outside blood vessels, or seroma, which is a buildup of fluid. In surgeries that requiring precise tissue rearrangement, such as tummy tucks or breast lifts, excessive movement can negatively impact the surgical results. It may cause issues like asymmetry, poor scarring, or even wound separation. Moreover, strenuous activity can exacerbate swelling and inflammation. While some swelling is normal during recovery, excessive swelling can delay healing and lead to discomfort. Another critical factor is that after surgery, your body's energy and resources are focused on healing. Engaging in demanding physical activity diverts these resources away from repair, which can prolong recovery and increase fatigue. This is why rest is essential during the initial recovery phase. Recovery guidelines typically recommend avoiding strenuous activities for a specific period, often ranging from 2 to 4 weeks, depending on the type of surgery and individual healing. For example, after fat transfer breast augmentation, patients are usually advised to avoid strenuous activities for 2 to 4 weeks to allow the transferred fat to establish a blood supply. Similarly, after procedures like buccal fat removal or eyelid surgery, avoiding vigorous activity for at least 1 to 2 weeks is important to minimize the risk of disrupting the healing process. It is also worth noting that strenuous activity is not limited to formal exercise. It can include any activity that significantly raises your heart rate or puts strain on the surgical area. Everyday tasks like carrying groceries or bending over frequently may need to be limited during the initial recovery period. Following your surgeon's specific instructions is vital, as recommendations can vary based on the type of surgery, your overall health, and how your body is healing. Gradually reintroducing activity under medical guidance helps ensure a safe and effective recovery. In summary, avoiding strenuous activity after surgery is emphasized to protect the surgical site, minimize complications, and support the body's natural healing processes. Always consult your healthcare provider for personalized advice tailored to your specific procedure and recovery progress.